Wow. I mean, this is just heartbreaking.
My left side is a lot worse than my right. You can see that a lot of them are open. They weep.
I heard about this woman who had radio frequency applied to her face with microneedling. So it was like a series, I think she says, of like 10 needles. And this was like some non-FDA approved device that was used on her face by someone who wasn't really licensed to do the procedure. And it's just so heartbreaking to see this beautiful woman sustain such damage to her face off of a non-invasive aesthetic procedure, right? We're not talking surgery here. This is something that was just supposed to help tighten her skin, maybe improve some of the texture of her skin, but not lead to this type of damage. And it just reminds us of so many important lessons here. One is that we need to make sure that people are going to properly trained providers who really have the right licensure and the right experience in training. Another one is that people who are performing various procedures should really be using proper equipment that is certified, that is properly maintained. The other point is that we really need to think about these like less invasive procedures and really consider if they truly are less invasive, because some of them have actually very significant risk. Things like filler can cause blindness and death of one's skin in an area called necrosis. Of course, surgery has its own set of risks, right? That should not be underappreciated, but we must remember that there are risks associated with these less invasive forms of aesthetic enhancements. And no one goes into an aesthetic procedure thinking that they're going to look worse afterwards. And I know that she's gone through like so many reparative procedures where all these lacerations then had to be sutured closed, and antibiotics and hyperbaric oxygen. And we have to remember that there are real risks in aesthetic procedures, and people who undergo these procedures need to accept that the risk exists, and you can mitigate some of that risk with going to the right person. But even so, there are problems that can occur. So I think the more people get various types of aesthetic enhancements, we will hear more and more about the complications that exist. Remember, a lot of people, if they sustain a complication, they're not often running to the internet to talk about it. So I wish this young woman all of the best. I hope that she has the best recovery and is able to not just restore her face to the best shape possible, but also just internally feel as positive as she can, given the difficult situation that she faces.